guys, welcome back to the channel. I'm Rich Feldenberg. I'm a pediatric nephrologist and I create videos about science and medicine. Today I'm going to talk to you about what are modifiable and non-modifiable risk factors for heart disease. So heart disease is really common and a lot of people do suffer from heart attacks and strokes. There are things that definitely put us at risk for the development of heart attacks and strokes. Some of those things we can do something about and others we can't. So let's talk about the non-modifiable risk factors first. Those are the things that we really can't adjust. They just happen to be what they are. So those include things like age, your ethnic background, and your family history. So with age, yeah, of course, we are the age we are. We're going to continue to get older. We can't do anything about that. And things like ethnic background and family history have a lot to do with our genetics, which again, we can't change. We're just born with the genetics that we have. But there are modifiable risk factors, and those are very important to know about because if we're aware of that, we can do things to minimize our risk for developing heart disease down the road. So some of the common modifiable risk factors are things like smoking. So obviously it's really important not to start smoking, or if you do already smoke, to then quit smoking. And you can talk to your physician about how you can help yourself to do this in a way that might be most successful. Another modifiable risk factor is high blood pressure. So it's important to get regular checkups so you know if you're developing high blood pressure. And if you do have high blood pressure, it's important that the blood pressure is treated so that it comes back down into a safe range on average. And there are many things you can do to help prevent high blood pressure, which also then, as a consequence, helps prevent you from getting cardiovascular disease. So that would be things like exercise, eating a low-salt diet, and maintaining a normal weight. Another modifiable risk factor is diabetes. So if you have diabetes, it's important to take very good care of it because very high blood sugars most of the time will accelerate cardiovascular disease and lead to early heart attacks and strokes. So taking really good care of your diabetes is important. And doing things that help prevent diabetes if you don't have it already are also extremely important, such as maintaining a normal weight and exercise. Weight and exercise are a really common theme. Another modifiable risk factor is high blood cholesterol. So again, getting regular checkups to know if your blood cholesterol is high is important because if it is high, then you can do things to try to lower it. Having that high blood cholesterol also accelerates cardiovascular disease. So lowering it helps to minimize that risk. And again, the things that help to prevent your blood cholesterol from going up are the same things we've already talked about. Good weight management, exercise, and a healthy diet. Also often listed as a modifiable risk factor is physical inactivity and being overweight. So as we've already mentioned, it's really important to stay physically active. That means doing regular exercise on a routine basis, at least 5 or 6 times per week, at least 20 to 30 minutes per session, and getting your heart rate up if you can, and keeping your weight in the healthy zone. So we usually want a BMI which is in the healthy zone, not too high or too low. Now it is important that if you start a new exercise program, you should talk to your doctor first to make sure that there's no reason why you can't safely begin exercising. But in general, it's very important that people maintain a healthy, active lifestyle so that they stay healthy and active for a longer period of time, and not only live longer, but stay healthier for a longer period of their life as well. So those are the modifiable and non-modifiable risk factors. Remember to stay healthy, and we'll see you here next time. Don't forget to like and subscribe, and be healthy, guys. See you later.